I'm fine. Hi, welcome to the Fit and Healthy Show. Today our subject matter will be on erectile dysfunction. Defining erectile dysfunction is a man's inability to attain or sustain an erection in order to sustain a full enjoyment of intercourse. Depending on what statistical data that you look at, it is estimated that about 85% of erectile dysfunction is physiologically related. That's not psychological, it's physiological. So there's actual physical reasons, causes, symptoms that cause the erectile dysfunction. Causes that I found in my research and based upon my experience at my health food stores. Number one, we see are hormonal changes that often occur with men, particularly when they get to be about 35 years and above. Their DHEA levels will drop, free testosterone, estrogen levels rise because of all the environmental estrogens, contributing factors. So hormonal changes in a man's body can contribute to erectile dysfunction, or actually the lack of libido as well, the desire to have sex. Prescription drugs, and this is a big one. Most of my customers that come in the store, I would say the majority of erectile dysfunction has to do with the actual prescription drugs that they're taking. And I've given a list here of the prescription drugs, particularly, and some of them you might find to be somewhat surprising as far as causing erectile dysfunction. Most of us know about antidepressants and high blood pressure, antihypertensive drugs contributing to high blood pressure. But I bet a lot of you didn't realize that things like Paxil, Tagamet, things that cause acid reductions can contribute to erectile dysfunction. Diuretics and high blood pressure diuretic medications, or there are classes of drugs, Lasix being one of them, that are diuretics. But what they found, approximately reported most commonly, is that there were over 200 different drugs that contributed to erectile dysfunction. So be sure to look on your warning labels, and if that's an issue that comes about as a result of your medication, then you're going to have to weigh the usage of a medication, something alternative to the medication, or whether you want to do it at all. Chronic illness. Now this has to do with things like arteriosclerosis, diabetes, blood pressure, circulatory types of diseases, because obviously in order for a man to obtain an erection and maintain an erection, you have to have blood flow. And so anything that blocks this blood flow will interfere with the ability to get there and stay there. So arteriosclerosis obviously is a buildup of cholesterol or minerals or just poor vascular health. We'll address some of the issues later on as far as what we can do to help with getting rid of some of that or helping with some of this circulation. Diabetes. 50% of men that have diabetes within the first 5 years report erectile dysfunction. And then from what we're understanding is the other 50% report it later on. So if you have diabetes, you need to get your blood sugars under control, you need to modify your diet, you need to exercise, because diabetes, hypertension, and blood pressure seem to all run together. So basically you need to work on getting your blood sugars under control. That chocolate ice cream at night ain't helping. Street drugs, marijuana and cocaine, and I hear from people, oh, it enhances things. The studies support otherwise, that it actually causes issues later on with ED. Fatigue, stress, anxiety, depression, these are all things obviously that are oftentimes environmentally caused. Somebody's overworking, you got screaming kids in the background, you got a screaming wife or husband in the background telling you you're not contributing enough. All those kinds of things can contribute to a person just absolutely just clicking right off. So reducing the fatigue aspects as far as overwork, getting that exercise moving, working on the depression, whatever's causing it directly, if it's environmentally caused or if it is caused from a biochemical issue, those issues need to be addressed if you're suffering from ED. Heavy metal poisoning. A lot of people that work in the plumbing industry or around metals, any type of metal exposure, lumber industry as well. Chemicals, heavy metals can contribute to poor blood flow and ED issues as well. We found that 30 minutes of exercise a day can greatly help improve circulation, because what it basically does is it gets the vascular system, the blood vessels, to exercise. So those good old couch potatoes that are complaining about ED, get your butts off the couch and start moving. And whatever it is, whether it's walking the dog, vacuuming the house, mowing the lawn, whatever it is, you need to get moving. Because unless those blood vessels get exercised, they're not used to maintaining their viable flexibility. Diet is a tremendous contributing factor as well to ED, and that includes sugars, high fats, the sludge that goes through the vascular system. Just bottom line, slows the vascular system. Eating big meals at dinner time and then an hour later expecting to go to bed, it isn't going to happen, because your circulation is all being devoted to your stomach and your digestion, and it's not going to be devoted otherwise. So do not eat a large meal if you expect to have sex in the evening. Chemical-laced products, we're finding out, dyes, preservatives, are all contributing to male ED. And as a result, sometimes we don't know, we eat these processed foods, and boom, there we go. We've got the chemical reaction, and we just don't know what happened. We think it's us. So, eating fruits, vegetables, foods high in fiber are a priority. Fiber removes the estrogen metabolites, heavy metals, and other things out of the body. Gets things moving. Grapefruit pectin fiber, for example, has actually been shown to lower cholesterol. It helps with the vascular system as well. The pectin fibers, they're very good binders and removers. Eating fresh fruits and vegetables, pumpkin seeds, whole grains, those types of foods are very enzyme nutrient dense. Those enzymes are also necessary. In order to get an erection, you have to have good flow, and men release nitric oxide, which helps them dilate the blood vessels. If you have anything that interferes with that ability of a man's blood vessels to dilate, then you're going to have erectile dysfunction. There are certain foods that I found in my research, not just folklore, but actual research, that supported natural help either with libido or with ED. And they included foods such as royal jelly, bee pollen, watercress leaves, which is more popular in an Asian diet, but not so much popular in the standard American diet. And some sesame seeds, a little sprinkle of some sesame seeds on a salad. Besides getting extra vitamin T, which helps with blood manufacturing, you're also going to help with ED issues too. I'd like to address with you today some supplements that I know of, aware of, and have personal experience with as far as helping with either libido or erectile dysfunction. And these, all of these can be taken in conjunction with medication, with just a couple exceptions, and I'll point those out as I go down the list with you on them. L-arginine, citrulline combinations increase blood flow and help with vasodilation, particularly one called, it's an alpha-ketoglutarate type of arginine that helps with vasodilation. It'll dilate the blood vessels, also releases growth hormone as well, which is a very youthing thing, but it can help lower blood pressure and increase circulation. A good multiple vitamin with zinc and copper. We also find contributing factors to ED can be prostate. And as men age or have more chemical exposure, the prostate can swell, and it can squeeze around the urethra tube, it can squeeze around everything and make it difficult to get an erection. So eating or having a good multiple vitamin high in zinc, copper, and then there's also something called saw palmetto, which can also help decrease some of that swelling around the exit pipes, so to speak. Cordyceps. I've written the dosages down of these various items so that you can and know what amounts the studies have supported work. 800 milligrams of cordyceps twice a day can help treat a lower libido and also as well impotence, that ED. There's Chinese studies to back that up. Same types of studies with Panax ginseng, also known as red Chinese ginseng, does the same type of thing in Chinese studies as well. Very supportive of male potency. Ginkgo biloba. Now that you have to be careful with as far as if you're on any blood thinners, because ginkgo thins the blood. It's also an anti-inflammatory and reduces vascular inflammation, but it thins the blood, and which in turn can increase blood flow. Also vitamin E as well can also increase blood flow and help lower that blood pressure and get more blood into those small capillaries and blood vessels. On DHEA. As I noted before, when a man is 35 and above, DHE levels can fall, and that can lend itself to lower levels of libido and actually can contribute to ED as well. So there are a series of tests that physicians can run when a man is having ED, besides checking the medications out and knowing the dietary factors and the chronic illness factors. Checking the DHEA levels with saliva, the progesterone levels with saliva, estrogen, testosterone, free testosterone. All these types of blood work and saliva testing your physician can do or perform via the laboratory to find out whether or not these issues may be a contributing factor towards your ED or lack of libido. Real good research on Mara Parama. 500 milligrams a day increased potency and libido. Avena sativa, 300 milligrams 3 times a day, increased libido. And also helps work on the nervous system. Sometimes we forget about the nervous system as feeding the male area as well, because there are a lot of nerves and sensitivity in that area. And so if your nervous system isn't in good working order, and diabetes causes an issue with diabetic neuropathy, and so do diabetic medications, the nervous system needs to be fed. Tribulus, libido and impotency, 500 milligrams 3 times a day. Ashwagandha, 1,000 milligrams 3 times a day. Ashwagandha also works on the adrenal glands and help you deal with everyday stress. It's also kind of a male tonic. It can help, and female as well, support. Niacin. Now, a lot of physicians are recommending niacin to help with cholesterol. Niacin can be utilized as a vasodilator, but you got to start off slow. The studies were done on 250 milligrams per day, but you get that little red tingling flush. Your whole body can turn kind of red, and you feel like you got spiders crawling all over you. But if you start off with like a 50 milligram a couple of times a day and gradually build up, niacin, in its conversion from the liver into niacinamide, can help with circulation as well, and cholesterol. Damiana, one of the few herbs that I found that can help with stabilization and maintaining of an erection, especially during intercourse. A lot of things will help get you there, but to get you to stay there, there's, like I had mentioned before, there's certain enzymes, in addition blood circulation, that helps you get there and stay there. And Damiana is very helpful for getting you to stay there. When we talk about vascular health and the vascular flexibility, we mentioned exercise as being very, very important to maintain that vascular flexibility, exercising the blood vessel muscles. Well, what we also like to address here too is to maintain that vascular flexibility with nutrients. And that would be a good multiple vitamin high in Bs, and maintaining at least 1,000 milligrams of vitamin C to induce collagen production, 1,000 milligrams twice a day. Really helps collagen output and helps with that vascular flexibility. I have literally seen cases of ED, blood pressure in combination with magnesium, which is also a vasorelaxer, lower blood pressure and help DD within 3 months. Just those 2 things. So getting better flexibility in the vascular system, because the arteries and the blood vessels, they get hardened with time. And as they harden with time, then they're no longer flexible, and then the blood won't flow. So very, very helpful, and you must keep in mind as well that that is necessary to maintain a good erection. I hope this induces you to do further research into the subject matter. Thank you very much, and we're going to move on to our fitness section of the show. Hi, welcome to the fitness portion of our show. Today I'd like to show you some upper body stretches that I think you can utilize either after your workout or once the body is warmed up, once you've taken a good walk. Flexibility is very, very important to maintain youth. And in Chinese and Oriental cultures, actually they say once you're no longer flexible, you are old. So maintaining that flexibility and balance is very, very important. Today I'm going to show you four upper body stretches that I think would be helpful, all of which I'd like you to really progress slowly, and if they feel out of reach for you, do it a little bit and very gradually at a time. The first stretch is you put your hand on top of your shoulder, and basically what you're going to do is you're just going to push this direction, trying to stretch these muscles right here and on the arm, the tricep and the shoulder. And then, of course, switching arms. And you'd like to hold your stretches a good 15 seconds at least. Some people say 30 seconds, but that stretching gets that muscle just to have more flexibility. The next stretch I'd like to show you is a tricep stretch. You put your hand behind your back, try to reach as far down as you can on your back, and you gently push up your arm at your elbow, stretching and trying to get a real good stretch through this area, holding that for about 15 seconds. The next stretch is a little bit more difficult. It involves, it's a yoga stretch, and so I need you to take caution. What you may notice, if you try it, you may get a little bit of spasms in the arm, so you want to do it nice and slowly because your body's probably not used to this much stretching. What you do is you put the hands behind here, and we'll get the right angle here. And what you're trying to do is you're trying to push your hands together in order to get a good back stretch, shoulder stretch. This is pretty much a complete arm stretch all the way. And you want to hold that for a good 15 seconds. Now mind you now, if you're only able to go like this, that's okay. Just gradually progress to where you can push those together and get that flexibility. And you can move it up further if you want to as more flexible. But remember too, if you have elbow issues or elbow injuries or rotator injuries, with caution always on those kinds of exercise. The last upper body exercise I'd like to show you, and I see this a lot with people who were little league, high school, and college ball players, particularly on the right arm, because they tend to throw with the right arm, are rotator issues, rotator cuff in this area. And there's an exercise I was shown by a sports medicine doctor that's very helpful at stretching and strengthening the rotator, and actually for diagnosing whether or not you have a rotator injury. So I kind of suggest this for ball players who are not injured to get that rotator kind of warmed up a little bit besides just swinging the arm all around. And what it is you hold your arm close to the side and you pivot outward like this to your tummy and outward. And so you're just going to take probably about 10 or 15 repetitions. Some physicians will have you, or trainers will have you do it with a light weight. And all you're doing is you're trying to work that rotator with keeping this stationary. That ends our fitness section of the show. Next we'll move on to our research analyst. Welcome to the research portion of our show. Today, Ralph Turchiano will address the latest, greatest research within the last 14 days. Ralph?
And thank you. Currently, the first story is U.S. reporters often do a poor job reporting about new medical treatments. What the Public Library of Science, otherwise short of PLOS, discovered through Schwartz's reviews, where they rated over 500 U.S. news stories that were published over the air over the past 2 years. They found in the medical news stories that 62 to 77% of those stories had major failings in quality of reporting. To give you an example, as quoted through the Public Library of Science, not me, ABC World News was graded only 2 out of 10 for a TV report about a new test for prostate cancer, a test that showed claim was more accurate than existing tests. This poor grade reflected the fact that ABC World News failed to discuss the enormous controversy surrounding the risks and benefits of prostate cancer screening, failed to discuss any evidence that the new test was superior, and failed to mention that the principal investigator of the new test received a share of the royalties received from the sales of the test. Schweitzer Same from the Public Library of Science said the high rate of inadequate reporting found in this study raises important questions about the quality of the information U.S. consumers receive from their news media on these health news topics. Complicit collaboration between scientists, reporters, medical journals in hyping news studies. That's probably why we can give you more information here in 5 minutes than they can all day, because their news is something more related to advertising than actual fact. After that, current vitamin D recommendations. Fraction of safe, perhaps essential levels for children. Often we like to live in a world where we believe if we eat healthy, we're getting adequate nutrients from our food. Many years ago, that may be the case. Through processing and refinement of food, some things may have changed. They say, and this is through the Endocrine Society Journal of Clinical Endocrinology and Metabolism, otherwise known as the JCEM. They say, not I, the current recommended daily allowance RDA of vitamin D for children is 200 IUs, but new research reveals that the children may need and can safely take 10 times that amount. What they discovered just to maintain normal blood levels of vitamin D for necessary bone and muscle growth, they found that children, or I should say adolescents or preteen, had to take 2,000 IUs of vitamin D per day. Sounds like a big number, but in reality it's not. And it's 10 times more than the U.S. government is recommending, which leads to a ton of bone issues with our children. So, they also said, none of the children in either trial that they ran showed any evidence of vitamin D intoxication at 2,000 IUs, just in case there's fear-mongers out there. Also, they said too, supplementation, this is their quote, word for word, supplementation of children and adolescents with 2,000 IUs a day of vitamin D3 is well tolerated and safe. This is particularly relevant in light of the increasingly recognized health benefits of vitamin D for adults and children. Follow up on vitamin D, might as well just keep on going with it. Low levels of vitamin D appear common in healthy children. They discovered that 52% of children were chronically deficient in vitamin D. 12.1% of those children were severely deficient in vitamin D. This means that 52% of the kids that they tested, there were normal kids in a regular setting, half of them were not going to have proper bone development when they got older, or muscle development, or nerve development, because they thought they were getting adequate levels of vitamin D from their current food supply, which in this case was not the case. In fact, often we associate vitamin D, we look for things like rickets or bending bones and things like that. Only one of the children of the 52% that were deficient in vitamin D showed any sign of rickets overtly. After that, they also discovered the first study of vitamin D in pediatric patients with low bone density. Nationwide Children's Hospital ran a study on children who were having bone difficulties upon growing up. They found out of the 80% of the kids who were diagnosed with bone disorders, 80% end up being just severely deficient in vitamin D. So, before you run and think of some genetic abnormality going on, cover the basics. It may not be a bad idea. After that, get off of vitamin D. Go back to something which is quite interesting, dehydrated tomatoes. Shows promise for preventing prostate cancer. Often we focus on one element of tomatoes called lycopene. The studies were coming out pretty positive, off and on, some good, some not so good. All showed promising, but to what level of promise was the question. Well, they discovered, and this was basically in the June 1st issue of Cancer Research, a journal of American Association for Cancer Research. They discovered there's a carbohydrate that is in tomatoes. They call it fruhis, F-R-U-H-I-S. I don't make the name up, I'm just reading as they say. An organic carbohydrate that when they fed to mice, for example, they found that 10% of the rats that were given the combination, this fruhis and lycopene, only had prostate tumors when they were injected with chemicals that cause cancer. Then 30% of the animals who just ate tomato powder got prostate cancer, whereas opposed to the the mice, which had no tomato byproducts whatsoever when injected with these deadly chemicals, 60% end up having prostate cancer. And here was the interesting information in regards to that. When combined with lycopene, fructose, the carbohydrate from tomatoes, stopped, and this is their words, not mine, from the Cancer Research Journal, stopped cancerous cell growth more than 98% of the time. To end the quote in the study, they said, quote, experiments like these suggest that a combination of fructose, the tomato carbohydrate, and lycopene should be investigated as a potential therapeutic anti-tumor agent, not just a prevention strategy. After that, we go back to pine bark. It keeps on reoccurring, coming up in regards to its health benefits. This one study shows pine bark naturally reduces cardiovascular risk factors in diabetics. What they did is they took individuals who were on the medication, on basically the metamorphin. They were taking, or I should say, anti-diabetic medications. They took antihypertensives, ACE inhibitors, such as lisinopril. And despite their medication to fast the blood sugars, they still could not get their sugar under control, and they couldn't get their blood pressure under control. So they had nothing to lose, so they gave them pycnogenol, pine bark. They found out that the group that was receiving the pine bark achieved blood pressure control in 58.3% of the patients at the end of just 12 weeks, with a 50% reduction in the medications required to reduce their blood pressure and their blood sugars. In fact, the mean average blood glucose level decreased to a healthy value by 16.7% after 12 weeks. Low-density lipoproteins also decreased by 12%. And their quote, they said, "It is amazing to see that adding pycnogenol to a regime of prescription medication brought blood glucose to a healthy level, allowed half the patients to reach healthy blood pressure, and enabled 58% to even lower the hypertensive medication," said Dr. Watson. An absolutely new finding is that pycnogenol appears to improve kidney function in diabetic people. This deserves more attention in future investigations. Pycnogenol should be a standard adjunct to pharmaceutical treatment of diabetic patients to help control any array of cardiovascular systems. And then, the more interesting aspect. This is something positive from Berkeley, University of California, Berkeley. All right. The good news is, and they said, that DNA defects can be fixed with vitamins and minerals. And basically this was done with the Berkeley, and this was done with the military. And in fact, they said, quote, "The simple supplementation with the vitamins can often restore some of the deficient enzymes to working full together." They discovered a long time ago that physicians were curing genetic disorders with vitamins themselves. Marini and Ryan, who ran the thing, said that an average person has about 5 defects per person, and these were all fixed by taking multivitamins. Thank you.
Thank you very much, Ralph. Thank you for joining the Fit and Healthy Show. We hope this show encourages you to do further research. Thanks.